welcome. Diabetes in India is a growing health problem with more than half of the population at risk of developing the condition at any given time in their lives. Diabetes mellitus is a widely diffuse chronic condition that impacts several aspects of patients' lives. If you do not manage this condition, you may well develop more severe complications. There's no cure for diabetes, but with well-managed diabetes, you can prevent many complications of diabetes. Diabetes management is more than the blood sugar control. Most people are still unaware about this fact. There's much debate around the cure and reversing of diabetes. People are being misled by half-truths or inaccurate information. There's several misconceptions about diabetes management and treatment. So it's important that people get correct information about it. To discuss this and other issues regarding diabetes, we have with us today an esteemed panel of experts. But if you have any questions you would like to ask them, send them to us via WhatsApp to the following number, +91 9167 66 6941. That's the number you can send us your questions to. Also send us your name as well as your locations. We have with us Dr. Shashank Joshi, past president RSSDI, the chair International Diabetes Federation Southeast Asia, endocrinologist Mumbai. We also have Dr. Banshi Saboo, immediate past president RSSDI, along with Dr. Sunil Jain, director of a Total Diabetes Hormone Institute in Indore. So a very good afternoon to all of you. Well, let's begin by asking Dr. Joshi. My very first question is, it true that poor sleep quality and a late sleep time associated with a more pronounced postprandial glycemic response to breakfast the following morning? What effect will it have on the prognosis of long-term diabetes? Dr. Shashank Joshi.
Divyaji, this is a very pertinent question. Short sleep, when you sleep less than 5 hours, or if you sleep too much, more than 10 hours, it directly impacts the quality of diabetes care as well as complications of diabetes, including heart disease, sudden heart attack, and complications including sudden death. So adequate sleep is equally important, and sleeping on time is equally important, and losing weight is also equally important. If you snore or if you sleep less, you may need to do a study, which is a dedicated study called sleep study. So sleeping on time and sleeping for a good 7 hours is very important for optimal sugar control.
Well, we also have Dr. Saboo joining us. Dr. Saboo, some medications can induce hyperglycemia. This has been observed in many patients who have recovered from COVID. Can drug-induced diabetes be reversed?
Yes, very important question, because during this COVID time, we had seen many of our patients, after taking steroids, they have developed hyperglycemia. So it is steroid-induced hyperglycemia, but a person may have a pre-existing diabetes, and maybe unmasking that person might be having diabetes, and just because steroid has been given to them and suddenly sugar is increased too much. So there are two possibilities. If patient was non-diabetic and only it is because of steroid-induced hyperglycemia, it may be reversed completely. But if they were having pre-existing diabetes, but they were not diagnosed because of they had never tested it, and steroid was given and sugar became very high, then it may not be possible for them to reverse it completely, but they may require treatment. As such, the newly diagnosed patients who are overweight or obese persons with significant weight reduction, diabetes can be reversed, and diabetes can be controlled with a minimal medication for long term.
Right. Thank you so much, Dr. Saboo, for getting us that answer. Now, is only blood sugar control sufficient for the effective management of diabetes, which other parameters are equally important to be controlled as far as people with diabetes is concerned? Let me take this question to Dr. Sunil Jain.
So, see, Divya, now blood sugar is basically one component of diabetes. And it's a myth that diabetes is just a sugar disease. There are two more components. One is high blood pressure, and secondly, bad cholesterol circulating in blood. And when we are treating a patient with diabetes, there are set parameters which we have learned in last 2-3 decades. And that's how when we are treating patients with diabetes, glucose, blood pressure, lipid, all these parameters has to be simultaneously under control. In addition, one very important point, in more than 20% patients with diabetes, Even at diagnosis, they may have diabetes complications like something in kidneys and nerves, etc. Because they might be having diabetes since long and detected today. So now these are the additional parameters that if there is any complication already going on, then that also must be considered. So this is a disease where a holistic approach for treatment is needed, not just blood sugar.
Right, holistic approach required in terms of treating diabetes. Thank you so much for answering that question. My next question is to Dr. Joshi. There are many therapies available in the market which claim to reverse diabetes. These include dietary supplements, alternative medicines and over-the-counter drugs as well. What is your advice to people on using such products? Dr. Joshi?
So these are certainly not recommended as standard of care. And you need to take these medications under expert advice or supervision of a diabetes expert or an endocrinologist. Remember, type 1 diabetes needs insulin for life and is not reversible. So does diabetes during pregnancy, which comes during pregnancy and goes away after pregnancy, needs diet and insulin. So does secondary diabetes where pancreas is absent. It's only type 2 diabetes in the first decade, that is in the first 10 years, has an element of reversibility. It can be reversed by lifestyle with technology. It can be reversed by medications of different nature, but all this has to be done under expert advice and supervision. A lot of weight loss therapies can impact diabetes reversal, and therefore we need to understand that remission in diabetes as well as reversal of diabetes is feasible for type 2 diabetes, particularly in the first 10 to 15 years. There's a lot of evidence-based and research which has gone into it, and that has to be done under expert medical advice. And there are newer medications. There are lifestyle adherence measures, there is restriction of calories, including bariatric surgery. They all can have some degree of limited remission of diabetes, and that has now been well defined. So there is a twin cycle hypothesis, fatty liver, fatty pancreas, which can be reversed by technologies like whole body digital twin or lifestyle modification or new age agents like SGLT2 inhibitors or GLP-1 receptor agents. But this all has to be done under expert advice of a hormone specialist or an endocrinologist or a diabetes expert or a medical doctor.
Right, keeping one's weight in check is definitely key as far as diabetes is concerned. My next question for people with diabetes, what should be the frequency of measuring their blood pressure? How can they detect a hypertension early, and are there any early symptoms that they should watch out for? This question is for Dr. Saboo.
So diabetes patients are more prone to have hypertension. Otherwise, also the hypertension incidence in our country is as high, or rather it is more in compared to even diabetes. As Dr. Sunil was talking, that a diabetes is just not the disease of glucose control. These are the patients who should also regularly monitor their blood pressure and cholesterol, and at the same time, it should be under good control. Now, blood pressure monitoring in a patient of a diabetes should be regularly monitored. If it is found to be high, then it should be doubly checked with the consultant. And if they find that there is a blood pressure is high, or they develop urine for microalbumin or albumin comes plus, then even with the normal blood pressure also, they need to give a medication which can protect their further kidney problem. And hypertension is to be controlled in these patients for kidney problem to be prevented as well as for heart problems to be prevented. So a diabetic patient should regularly monitor their blood pressure, and as and when it is high, it should be under good control. Diabetic patient also should monitor their cholesterol annually, and it should be also under control for prevention of diabetes complications like heart and kidney problems.
Right, so blood pressure and cholesterol should be checked every now and then for someone suffering from diabetes. Moving on to my next question, a close link exists between diabetes and cardiovascular diseases. How does the diabetes mellitus increase the risk of cardiovascular events in patients with hypertension? Dr. Sunil Jain.
Yeah, so Divya, now this is a point which requires some understanding. Because many people carry a myth that diabetes is a food disorder, as if just eating causes diabetes, which is wrong. There is some genetics or bad lifestyle, which all leads to generation of a process called insulin resistance. So for a simple layman to understand, our pancreas is producing insulin, but it is not able to work properly. And when insulin is not able to work properly at tissues, it now leads to some changes in our blood vessels, some changes in the heart. That's how diabetes and cardiac or heart problem, they very often coexist. This is called common soil origin. From the same soil, these things are originating. So when a patient is adopting a bad lifestyle, genetics, bad eating habits, becoming obese, particularly develop a lot of fat around abdomen, now their insulin system become dysfunctional. This insulin resistance start changes. And finally, by the time patients develop diabetes, there are some changes happening in the cardiovascular, that is heart and blood vessels as well. And that's why when a patient is diagnosed diabetes, I'm talking of type 2 diabetes, the common diabetes. So when the patient is diagnosed type 2 diabetes, the aim of treating expert is not only to control sugar, but we have to do all the efforts to reduce the risk of cardiac problems, because it is the heart which suffers most at the end, and that is the most common cause of death in patients with diabetes. So yes, there is a close link and there is a mechanism existing for that.
Right. Thank you so much for simplifying it for us, Dr. Sunil Jain. With that, we're slipping into a very short break. If you have any questions you would like to ask them, send them to us via WhatsApp on the following number. That's 9167666941. That's the number you can send us your questions. Don't forget to put in your name as well as your location. Welcome back to our special show, Beat Diabetes Myths and Facts. We have with us Dr. Saboo, Dr. Jain and Dr. Joshi. Taking my question to Dr. Joshi, widespread fear, helplessness, illness and death, along with economic hardship caused by the pandemic, has resulted in increased stress levels. Has this stress impacted diabetes management as well? Doctor?
Absolutely. I think, in these pandemic times, anxiety, mental stress, lack of sleep, binge eating, lack of physical activity, all of that has led to a perfect storm which makes us predisposed to both diabetes, heart disease and various other non-communicable diseases. So as we had a tsunami of COVID-related virus illnesses, there is also has been a spurt in the rise of number of cases due to diabetes, heart disease and non-communicable diseases, including mental health diseases. And it has not only impacted just diabetes incidence, but also the complications have gone up and the number of deaths have gone up. In 2017, 4 million people on planet Earth were losing their lives due to diabetes. And that number from the International Diabetes Federation, the Southeast Asia which I represent, has now gone up to 6.8 million. So clearly the implications of the pandemic and the stress levels have been very hostile. And that is why it is very important to have an appropriate lifestyle of eat less, walk more, sleep well and smile and be stress free. Don't take or give stress. It's very, very crucial and important to recognize these facts.
Right, like Dr. Joshi is pointing out, to control as far as those stress levels are concerned, sleep more, eat less and continue having that smile on your face. So, well, my next question is, relatively younger population is being diagnosed with pre-diabetes or with diabetes. What eating patterns should they maintain while working from home? Dr. Saboo, if you could answer that.
Yes. So first I will agree with what Shashank was talking, that same for the pre-diabetic population or the young person, they should also have the sleep more and less stress will definitely have a better quality of life. But at the same time, the eating pattern for the persons who are now more sedentary and not very physically active, I will say it's an healthy lifestyle for everyone, whether someone is lean or thin or somebody is sedentary or somebody is very active. What they should eat should be less of carbohydrate. Whatever the carbs which they are taking, it should be complex carb. Direct sugar should be reduced or minimized, and very important, high protein intake and high fiber in their diet. As we are moving with the Western diet, our diet is becoming more of a simple carbs. It is having less less protein and less fiber also. So what is been requested to everyone, they should have a regular exercise of 30 minutes per day. They should be more physically active, and at the same time they should eat more fibers and complex carbohydrate with more protein in their diet.
Right, to increase the carbohydrate intake in their diet. Moving on, Dr. Jain, the diabetes management as far as the process is concerned, it's a lifelong process. This includes achieving a delicate balance between lifestyle management and medication. Can you elaborate as to the idea of a balance between the two that should be targeted by people with diabetes? Doctor?
Yeah, so Divya, so to understand this issue, because this is a very common problem we face in day-to-day practice, that when a new patient of type 2 diabetes will come to us, their first request will be, doctor, can you treat us without medication? So now we have to understand here what is the role of lifestyle and what is the role of medications. Now diabetes is a disease with multiple defects. There are 10-12 defects described, which finally leads to high glucose and many other changes happening in our body. The lifestyle changes like following a healthy and balanced diet, yoga, exercise, stress management, this is rectifying few defects. But in addition, we require medications, and there are different kind of medications which will be defect specific. They will work on those defects, and that's how we can take care of a good diabetes control. Now here, two very important points which I feel that every patient of diabetes should know. The day their diabetes is diagnosed, it's not day one. 5 to 10 years prior to diabetes diagnosis, many changes were happening in their body. And the day diabetes is diagnosed, their pancreas, who secretes insulin, already its functional capacity has gone down permanently. That is one. And secondly, over a period of time, their pancreatic function is going to decrease. It is not going to increase. And that's how lifestyle modification and certain medications which are supporting the pancreatic system, which are prescribed by doctors, the combination of these two is most important for long-term care of diabetes. So they are complementary to each other. Lifestyle modification plus right medication which are prescribed by the doctors to rectify those defects which are lying in the patient. If these two are done together, then we can have 1 + 1 = 11 impact. That is what is going to happen with this combination.
Right, Dr. Sunil Jain, they're simplifying it for us. Well, my next question is to Dr. Jain. Dr. Jain, if you can just give us some tips about people who might have just recovered from COVID, the Omicron variant. Well, we also heard the CGI of India talking about how it is a silent killer and how it's taken him 25 days, longer than the previous time that he got it. It's taken him 25 days to recover. Any tips on people who are recovering from COVID as far as a faster recovery is concerned?
So those patients who are from COVID and suppose they are having diabetes, we know that a good glycemic control, and there were many studies on this, that what was their previous glycemic control when they had infection, that had carried a big impact on the mortality and morbidity. We don't know whether the COVID era has ended yet. So nobody knows what will happen after 3-4 months. Another variant you can have. So it's a high time that the patients with diabetes should keep their glucose under control, because it's ultimately the matter of the immune system where high glucose also plays a big role.
Right. Also, I would like to take the same question to Dr. Saboo. If you can give us some tips as to how to recover from COVID, what are the things that we need to look out for? What are the things that we should avoid?
So one very important thing for the COVID, as Dr. Jain was talking, that sugar monitoring is now considered, it's like fifth vital sign. The way for a COVID patients, we measure their pulse, the temperature, the oxygen saturation, the respiratory rate. The similar way, the sugar monitoring should be done for a person with diabetes, or even for non-diabetic also, as you were talking before, that there are patients who are recently diagnosed or because of steroid induced, they may have hyperglycemia. For better COVID recovery, as we are seeing that this time the COVID, the third wave, found to be little milder in terms of the infection, but still the patients who are at high risk, or those who are diabetes uncontrolled, long standing with comorbidities like cancer, obesity, cardiovascular disease, we found them, they get hospitalized also, and they may develop the complications of COVID. Right. For a faster recovery of the COVID infection, those who are healthy, those who are managing their other systems well, they found to have a better recovery in compared to the patients who are having other comorbid conditions.
Right. Dr. Joshi, my next question is to you. What are the tips as far as diabetes is concerned? Give us some tips to keep our diabetes in check.
So I think you should have a very simple approach. One is lifestyle and one is a ABCDE approach. So the lifestyle approach, as I said earlier, is eat slowly, eat on time, eat right and eat less. Walk more, do 10,000 steps a day, do some yoga and pranayam, do some Surya Namaskar, do some pranayama, do some meditation. Try to sleep for a good 7 hours, sleep on time, try to sleep at around 10 o'clock at night and get good quality sleep. Beyond that, be smiling, be cheerful, be positive. But follow a simple ABCDEF approach. A for A1C, try to keep your 3 months average sugar below 6% to 7%. Try to keep your blood pressure below 130/80. Try to keep your cholesterol, which is the LDL cholesterol, below 50 or 70. Try to get a cardiac checkup done once a year. Try to do proper diet and ease for exercise, and also get your eye checked once a year. And keep your feet clean. And if you do these proper lifestyle measures and live happy, see, it is very important that you need to be healthy when you are living with diabetes. But equally important is that we should also be happy and cheerful. Remember, if you are able to handle your diabetes with happiness, you will live longer. You will live longer than your healthcare providers, doctors, and people at large who don't have diabetes. So diabetes is a very manageable condition. There are areas in diabetes which are also reversible, and remission is also possible. But we need that happiness, we need discipline, and we need to do simple things, but we need to do them consistently and persistently without any breaks or cheats.
Right, doctor pointing out an eye checkup annually is also very important, including, amongst other checkups as well. Now, my next question is, can a person suffering from diabetes, how can they manage and control and ensure that they do not, put their heart at risk? As far as those cardiovascular problems are concerned, how can we ensure? I mean, you have spoken about eating less, you have spoken about exercising, you have spoken about keeping yourself in a very healthy and happy frame of mind, but in order to keep our heart very happy, give us a few tips.
So you are asking
Dr. Jain.
Okay,
Yeah.
Doctor.
So Divya, here Dr. Shashank has already explained many areas. Now what I would like to say here, what happens many times, patient with diabetes, since they are asymptomatic, so they stop monitoring. Like when we were talking, HbA1c or glucose should be around HbA1c, that is the last 3 months average has to be around 6 to 7. That means most of the fasting glucose, postprandial glucose also should be under control. So the patients with diabetes need to have these targets under control. They should get their blood pressure monitored. If they assume that, okay, I don't have any headache, I don't have any dizziness, that means my blood pressure is normal. If I don't have any such symptoms, that means my glucose is under control. This is wrong. So they need to get themselves checked, because the objective of diabetes management is to keep the biochemistry normal. And if we can keep their biochemistry normal, then the periodic checkups which Dr. Joshi was talking, we expect that these patients should most often turn out to be normal. But what happens in our day-to-day practice, somebody who is diagnosed diabetes, hypertension, bad cholesterol, prescribed all medications. Now what happens down the line after 3 to 6 months, since this fellow is asymptomatic, he stops medication. And this goes on for 2, 3, 5 years. And then suddenly one day a myocardial infarction or a heart attack appears. So my suggestion here will be, our patients need to accept that diabetes is a disorder which requires regular check, right, regular medications, and that's how we can prevent these complications.
Right. Thank you so much, Dr. Jain, Dr. Joshi and Dr. Saboo for joining us on the panel today. If you have any questions you would like to ask, send us your questions via WhatsApp on 9167 666941. That's the number that you can send us your questions. Don't forget to put in your name as well as your location. Thank you so much for your time.